So I have a question about not being able to feel the thigh for several years. Hey, I'm Dr. Wendy, physical therapist, and I have taken care of women for 17 years. I specialize in orthopedics, manual therapy, and all things fun in the pelvis. And one of the fun things is nerve entrapment. There is a unique nerve called your lateral femoral cutaneous nerve that is just a sensory nerve on the outside of the thigh. If you have had trauma to your thigh, your hip, your pelvis, if you have some asymmetry happening in your pelvis, you could have pressure being placed on this sensory nerve. Where your nerves are bothering you, there's a lot of nerves, and your lateral fem is just the outside strip. If you are having issues on your inside thigh, the front of your thigh, the back of the thigh, all these things mean different nerves. And there are sensory nerves and motor nerves. Your femoral nerve is in the front. Obviously, there's motor and sensation with that. Your sciatic nerve is in the back. Obviously, there's motor and sensation with that. But if you have had some chronic numbness, that totally stings. I hate that for you. Hopefully, you can find a healthcare practitioner to help you assess what nerve is being entrapped and why is it being entrapped. The gold standard for assessment is a diagnostic ultrasound. And there is a phenomenal doctor in Washington, D.C., and her name is Dr. Yousefi. And Dr. Yousefi uses a diagnostic ultrasound to see if there are any fibrous adhesions, if the nerve is getting the conduction it needs. Sometimes doctors do EMGs to assess which nerves are not firing and why, and those are horrible tests. I mean, they're good tests, but they put a needle into the nerve and use electricity to find how the nerve conduction is happening. Diagnostic ultrasound is super easy, but it's hard to find. And so anyway, sometimes the numbness can mean the nerve is being entrapped. Sometimes there is actual long-term damage, but that's not usually the case. So anyway, if you could find somebody to help you, that would be nice. If you could find somebody to do a diagnostic ultrasound, an EMG, or somebody like myself to look at you mechanically to see if there's something happening in your pelvis that's causing the nerve to not be able to move, slide, and glide and gives you an entrapment.